Welcome to Your Health. I'm your host, Rhonda Alford, and joining us on this episode is Celeste Thibodeau, RN, Program Director at Terrebonne General Wound Healing and Hyperbaric Medicine Clinic. Today we will discuss wound care and foot health prevention, treatment, and management. Welcome to the show, Celeste.
Thanks for having me, Rhonda.
All right, well, let's get started with you telling us a little bit more about yourself and your role at Terrebonne General.
So at Terrebonne General, I am currently the program director of the Wound and Hyperbaric Clinic. I've been a nurse for about 18 years. In the past 4 years, I've been in the wound clinic. And as program director, I'm responsible for the day-to-day operations of the clinic and making sure that our staff provides the patients with the best care possible and all their needs are being met.
And I know y'all are doing an excellent job over there.
Thank you.
All right, well, we're going to talk about a very important subject today, wound care and foot health. So the first question is, why is wound care and foot health so important for people with diabetes?
It is very important for patients with diabetics with foot wounds because they are at a higher chance of getting infections, which can lead to amputations, and we don't want that to happen.
Yeah, that's almost as serious as it can be.
Yes.
So what type of foot wounds do you treat over at the wound center?
So we treat a variety of different wounds, including pressure ulcers, diabetic foot ulcers, venous ulcers, arterial ulcers, surgical wounds that have not healed. Pretty much we'll treat any type of wound that we see.
And how is treatment at the wound center different from at a doctor's office?
So at the wound center, all our staff is trained specifically in wound care, and they receive continued education to stay up to date on the top practices. We're also able to provide patients with a lot of different treatment options that most places are not able to offer, including hyperbarics.
Okay, well, tell us, what is hyperbaric oxygen therapy and how does it work?
So hyperbaric oxygen therapy is where we provide an environment of 100% oxygen that's pressurized. So it almost feels like you're going up in an airplane or going scuba diving. And this helps to push the oxygen into the body, which aids in the healing process. It also activates the white blood cells in the body to help with the healing process.
Sounds pretty high tech.
It is.
So what conditions do you treat with this hyperbaric therapy?
So the most common conditions that we treat are diabetic foot ulcers that have a bone infection called osteomyelitis, or there are situations where they'll have osteomyelitis in another part of the body, and despite having standard treatment, the osteomyelitis comes back, so it's chronic refractory osteomyelitis, and we're able to treat that with the hyperbarics. Also, we're able to treat patients who've had some type of injury from radiation treatments. Also, patients that have a compromised skin graft or skin flap, we're able to aid in that healing process.
That's wonderful that you offer that option, but there's some practices that you would recommend for patients to prevent foot wounds, particularly those that are at high risk, right?
Yes, there's definitely some great practices out there that people can adapt to help with their foot hygiene. Some important one is doing routine foot checks, and you want to make sure that your feet are staying clean, that you're wearing properly fitting shoes. You don't want to walk around barefoot. And you want to do routine follow-ups with your primary care doctor or your endocrinologist.
Okay, and how does wound care differ from treating wounds compared to other treatments?
So with foot ulcers, they can be difficult to treat because they are at the furthest away from your heart. So a lot of times people will have blood flow issues. Also with diabetics, they're at a high risk for having what we call neuropathy, which is decreased sensation in their feet, which can lead to them not even realizing that they have a wound. So sometimes it delays in their care of not getting treatments.
So you have to be particularly observant
Right. You have to keep a good eye on it.
What advice would you give to someone who wants to improve their foot health but isn't sure where to start?
The most important thing that you can do is to start with daily foot checks. So to do that is you want to sit down in a nice, comfortable place.
Mhm.
If you can be in front of a mirror would be the best, or if you can get a handheld mirror and you want to take off your socks and shoes and use the mirror to take a look at the bottom of your feet to make sure that you don't have no dry or cracked areas or no sores that's developing. And if you're unable to see them, then it'd be good to get a family member or a friend to be able to help you with those daily checks. Also, you want to make sure that you have properly fitting shoes and make sure that you're always keeping your feet clean.
Okay, basic things there.
Yes,
So, what's the one most important thing you want people to know about foot health?
is that it is extremely important to keep your feet clean, keep them healthy, keep an eye on them in order to help you live high quality life.
Okay, well, how can someone learn more or schedule an appointment with you?
So to go ahead and schedule the appointment, all you would have to do is give the clinic a call at 985-873-4176, and we can go ahead and get you scheduled.
Thanks so much for being with us, Celeste.
Thank you.
For more information about foot health and wound care, visit tghealthsystem.com. Thanks for joining us on To Your Health. I'm your host, Rhonda Alfred, and we'll see you right back here next week.
So much to see on HTV. Stick with us 'cause we're your home.